Dr. Rafael, a 28-year-old newly graduated physician, was eager to kickstart his career at Santa Clara Hospital, a small medical institution nestled in the peaceful town of Brooksville. Since childhood, Rafael had dreamed of becoming a doctor, inspired by the tales of his grandfather, who had also been a doctor and served the community with dedication and care. Now, after years of study and training, he finally had the chance to make a difference in people's lives. Brooksville was a tranquil town, known for its picturesque landscapes and the warmth of its inhabitants. Despite its small size, Santa Clara Hospital was a vital hub for the community. With a team of dedicated professionals, the hospital acted as a true sanctuary for those in need, treating everything from minor household accidents to more complex cases. On his first day of work, Rafael was introduced to the hospital's daily routine. Mornings were always bustling with outpatient consultations, while afternoons often involved more detailed procedures and emergencies. Rafael quickly stood out for his enthusiasm and the empathy with which he treated each patient. His charisma and dedication didn't go unnoticed by colleagues and patients who began to trust him. It was during one of these busy afternoons that Rafael met Clara. A 25-year-old woman, Clara had been the victim of a serious car accident. She was rushed to the hospital, unconscious and with severe injuries. Doctors struggled to stabilize her, but the damage to her brain was severe, resulting in a coma. Rafael felt an immediate empathy for Clara. Watching her in her hospital bed, with machines monitoring every aspect of her health, he couldn't help but imagine the vibrant life she must have had before the accident. Talking to Clara's family, Rafael learned that she was a young woman full of life and dreams, beloved by everyone around her. Caring for Clara became an integral part of Rafael's days. He would often stop by her room, checking her vital signs, adjusting medications, and talking to her, even though the chances of her hearing were minimal. These daily visits created a silent bond between the doctor and the patient. Rafael's determination to see Clara awake grew stronger every day, and he vowed to do everything in his power to help in her recovery. As Rafael adjusted to life in the hospital and to increasing responsibilities, Clara's presence and the uncertainty about her fate served as a constant reminder of the value of his work and the fragility of life. He devoted himself even more to his patients, finding in each interaction an opportunity to honor his grandfather's memory and fulfill his purpose as a doctor. Dr. Rafael, with his generous heart and tireless spirit, quickly found himself emotionally involved with Clara's story and her family. With each visit to Clara's room, he felt a greater weight of responsibility and a deeper connection with the young woman in a coma. Rafael began to see himself not only as a doctor caring for a patient, but as a temporary guardian of Clara, a protector in her moment of greatest vulnerability. During one of his conversations with Clara's family, Rafael uncovered a surprising and touching piece of news. Clara was 3 months pregnant when she had the accident. The revelation left Rafael with a mix of emotions, from sadness for the tragedy that had befallen the young woman and her baby, to hope that a miracle could happen. He knew the situation was delicate and that the lives of the mother and the baby were at risk, but this only reinforced his determination to fight even harder for Clara's recovery. Clara's family was a constant presence in the hospital. Her parents, though visibly shaken by the situation, held on to faith and hope, and her older sister, Laura, became a central figure in providing emotional support to Clara. Laura was 7 months pregnant herself, and even with her own advanced pregnancy, she never failed to visit her sister. Laura was a strong and determined woman. She took care of her parents, kept up with hospital visits, and at the same time, prepared for the arrival of her own baby. Rafael noticed Laura's silent strength and on many occasions felt inspired by her resilience. He also noticed the pain in her eyes, the internal struggle between happiness for her pregnancy and anguish over Clara's condition. Rafael and Laura began to develop a sincere friendship. In the many hours spent by Clara's bedside, they talked about life, shared stories, and sought support from each other. Rafael offered medical explanations and words of comfort, while Laura brought accounts of Clara's happy memories, hoping that these moments of joy could somehow reach her sister in a coma. With each passing day, Rafael felt more involved in Clara's story and her family's. He tirelessly studied traumatic brain injuries and treatment methods, attended medical meetings discussing the best course of action, and, above all, kept hope alive. He knew the road would be tough and uncertain, but he was determined to fight for Clara and her baby. The bond between Rafael, Clara, and her family grew stronger every day. He wasn't just treating a patient in a coma. He was becoming part of a story of love, loss, and hope. Every visit, every conversation, and every small progress Clara made was one more step in the emotional journey that Rafael embraced with all his heart. Months passed, and to Rafael and Clara's family's despair, her condition remained unchanged. Each day brought the same painful routine: rigorous medical care, constant family visits, and the distress of seeing Clara motionless, with no signs of awakening. Rafael, though discouraged, never lost hope. He continued to study similar cases, seek new techniques and treatments, and talk to Clara, believing that somehow she could hear him. Laura, always present and strong, began to feel the pressure of the situation. Her 7-month pregnancy progressed, and along with the joy of her baby's imminent arrival came worries about her sister. Sleepless nights and accumulated stress began to take their toll. One day, while by Clara's bedside, Laura felt a sharp pain in her belly. Contractions, premature ones. Rafael's heart raced as he saw Laura's face contorted in pain. Rafael immediately called the medical team. Laura was rushed to the examination room. The diagnosis was clear: premature contractions. The obstetrician explained that the situation was concerning, but with absolute rest and continuous monitoring, they could try to delay labor for as long as possible to ensure the baby's safety. Laura was admitted to the same hospital, in a room close to Clara's, so she could be closely monitored. While Laura struggled to maintain her pregnancy, Rafael continued to care for Clara with renewed fervor. He knew he couldn't fail these two sisters who now meant so much to him. One night, while reviewing Clara's vital signs, he noticed something strange. Her fingers moved, almost imperceptibly. Rafael, with a racing heart, conducted a series of simple tests, like gentle stimuli on her feet and hands. Clara had small involuntary responses, subtle but clear signs of recovery. The discovery brought a wave of emotion and hope. Rafael rushed to call the other doctors and Clara's family. Though minimal, these were significant responses. They were signs that Clara was somehow beginning to react. The news was received with tears of joy and relief, especially by Laura, who, despite her delicate condition, found the strength to smile again. The doctors explained that these small responses didn't guarantee a full recovery, but they were a breakthrough. Clara was fighting, and now more than ever, Rafael and his team were determined to do everything in their power to support this fight. With the new signs of hope, care intensified and monitoring became even stricter. Laura, still in absolute rest, was now an anxious visitor in Clara's room, full of renewed hopes. Rafael kept her informed of every small progress, every involuntary movement of Clara. The fight for Clara and Laura's baby became a symbol of resilience and hope for everyone in the hospital. Meanwhile, the connection between Rafael and Laura strengthened. They shared a bond of care and hope that transcended the doctor-patient relationship. Amidst the chaos and fear, their friendship and mutual support offered a welcome relief. And so, amidst tears, pain, and hope, the battle for Clara's life and Laura's baby continued. The entire hospital became involved in the story of these two sisters, hoping for miracles to happen and bring the peace everyone longed for. The atmosphere in the hospital grew tense when Laura, even in absolute rest, went into premature labor. Rafael was urgently called to Laura's room, where he found the obstetric team preparing for an emergency cesarean section. Laura was in critical condition, with intense pain and unstable vital signs. The baby, at only 7 months gestation, faced significant risks, but the medical team was determined to do everything possible to save mother and child. As preparations for the surgery progressed, a nurse rushed to Rafael, breathless. Clara, who was being continuously monitored, showed new signs of recovery. She had moved her hand more noticeably, and reportedly, her eyes had briefly opened. The news left Rafael in a whirlwind of emotions. Clara, after months of coma, was finally showing clear signs of waking up. He wanted to rush to her room, but Laura needed him now, more than ever. Divided between two crises, Rafael made a quick decision. He delegated Clara's case supervision to a trusted colleague, Dr. Miguel, while he focused on Laura. Dr. Miguel was experienced and familiar with Clara's case, which gave Rafael some peace of mind to focus on Laura. The cesarean section began, and Rafael, along with the obstetric team, fought against time. Laura was losing a lot of blood, and the baby needed to be born as soon as possible to have a chance of survival. The atmosphere was chaotic, with machines beeping and nervous voices coordinating the operation. Rafael maintained an outward calm, but inside, his mind was torn between the operating room and Clara's room. Finally, the baby was born. A weak cry, but present, echoed through the room, bringing a mix of relief and apprehension. The newborn was immediately taken to the neonatal ICU, where a specialized team began to care for him. Laura, however, remained in critical condition. The blood loss was severe, and the medical team worked tirelessly to stabilize her. Meanwhile, in Clara's room, Dr. Miguel watched closely for changes. Clara opened her eyes again, this time for longer. She seemed to be trying to focus, moving her fingers more cohesively. Dr. Miguel, touched, began to speak to her, encouraging her to keep fighting. He knew that every small movement was a big step in her recovery. Back in the operating room, Rafael and the team managed to stabilize Laura. Her blood pressure returned to normal, and vital signs began to stabilize. Exhausted but relieved, Rafael left the room, leaving Laura under the care of the postoperative team. He went straight to Clara's room, where he found Dr. Miguel and the team emotional. Clara was awake, still weak and confused, but conscious. Rafael approached Clara, holding her hand. She looked at him, blinking slowly, as if trying to remember something. He talked to her, telling her about Laura and the baby, about the struggle everyone was going through. Clara's eyes filled with tears, and she squeezed Rafael's hand with surprising strength for someone who had been in a coma for so long. The news spread throughout the hospital, bringing a rare moment of joy amidst the chaos. Laura, still weak, was informed about Clara's recovery and her baby's condition, who was receiving the best possible care. She smiled, relieved, silently thanking her unconscious sister for the strength she had given her. The climax brought a mix of emotions: the tension of almost losing Laura and her baby, the miracle of Clara's recovery, and the unity of everyone in a moment of extreme difficulty. Rafael, exhausted but relieved, knew the road ahead would still be long, but those small miracles gave hope to everyone. The hospital waiting room was filled with anticipation and anxiety. The news of Laura's baby's birth spread quickly among family and friends, bringing a ray of hope amidst the worry. Everyone awaited news of Laura and the baby's condition, hoping for a positive outcome. Hours passed since Laura's premature baby was born. The medical team finally brought news to the family. The baby, despite being born premature, was healthy and stable in the neonatal ICU, receiving all necessary care. A collective sigh of relief echoed in the waiting room upon hearing this news, but joy was quickly replaced by concern when the doctor explained Laura's situation. Laura, after giving birth, suffered postpartum complications and fell into a coma. The news shocked the family. While they celebrated the baby's arrival, they now faced the challenge of dealing with Laura's critical condition. Tears of joy turned into tears of sadness and worry. Meanwhile, in Clara's room, a miracle was happening. After months in a coma, Clara fully awakened. The initial confusion of waking up in an unfamiliar environment left her stunned, but gradually she began to recognize the faces around her and understand what had happened. Her recovery surprised everyone, bringing a new ray of hope to the family. However, Clara was still weak and confused. She struggled to remember the events that led to her coma and tried to comprehend what was happening around her. The family, though relieved at her recovery, now faced the challenge of helping her adapt to this new reality. The waiting room became a whirlwind of contrasting emotions. While some celebrated Clara's miraculous recovery, others clung to the hope that Laura would wake up from her coma. The family united in a mixture of shock, mourning, and gratitude, facing together the challenges that lay ahead. The future remained uncertain, but the family's strength and mutual support would be essential in overcoming the obstacles ahead. As Clara began to adapt to her newly regained consciousness, a shocking revelation came to light. In a heartfelt conversation with the doctor and her family, Clara confessed that she was pregnant by a man who was not her boyfriend at the time of the accident. The secret had been deeply buried within her, but now it emerged, casting a shadow of tension over the family. Clara's confession shook the foundations of the family dynamic. Shock and disbelief flooded the room as everyone tried to process the revelation. The family found themselves confronted with a disconcerting truth that challenged their perceptions of Clara and their relationship with her. For the doctor, the revelation brought a wave of internal conflicts. He questioned his own decisions and emotions involved in Clara's case. Feelings of confusion and uncertainty began to mix with his professional dedication, challenging his medical ethics and sense of empathy. As the family tried to grasp the meaning of this revelation, the doctor found himself faced with a new layer of complexity in his involvement with Clara's case. He realized that the boundaries between his professional and personal life were becoming increasingly blurred, leaving him at a moral and emotional crossroads. As everyone struggled to assimilate the revealed truth, the tension in the air was palpable. Clara's secret cast a shadow over the family and the doctor, triggering a journey of self-reflection and ethical challenges that would test the limits of their convictions and relationships. Faced with Clara's shocking revelation and the challenge it posed for the family, the doctor assumed a crucial role in seeking resolution and emotional healing. Recognizing the importance of psychological and emotional support, he committed to helping the family confront the new reality. With compassion and professionalism, he offered guidance and support, helping them navigate the complex emotions that arose. Clara, strengthened by the support of her family and the doctor, began to recover not only physically but also emotionally. She reconnected with her loved ones, opening up to honest conversations and rebuilding the bonds that had been shaken by the revelation of her secret. Preparing for the role of motherhood, Clara found determination and hope in a future full of possibilities. Meanwhile, Laura remained in a coma, a constant presence of concern and hope in the family's life. Despite the difficulties, there was a unified sense of optimism and dedication in caring for her and her newborn baby. The doctor and the family joined forces, sharing the burden of uncertainty and maintaining faith in a positive outcome. The hospital became a center of support and healing, where compassion and solidarity guided every step of the recovery process. As they faced the challenges of the present, everyone came together in a spirit of love and determination, finding comfort in each other's strength. Despite the adversities, there was hope on the horizon, a light that shone even in the darkest of circumstances. The doctor, whose path had intertwined with Clara's and Laura's, cultivated a meaningful friendship with Clara, based on respect, understanding, and mutual support. This friendship transcended the barriers of professionalism, enriching their lives in profound and meaningful ways. Meanwhile, Laura, who had remained in a coma for so long, began to show encouraging signs of recovery. Her gradual improvement brought a renewal of hope to her family, signaling a new chapter in her journey of healing and rebirth. The story concludes with a powerful message of resilience and solidarity. In the face of adversity, Clara, Laura, their families, and the doctor discovered the importance of mutual support, both familial and professional. Their experiences illustrate the human capacity to overcome challenges, find strength in community, and emerge, transformed, on the other side of adversity.